Good afternoon, Dr. Barry Gritz, Houston's dancing psychiatrist. What are we going to be talking about today? Good question. I'm glad y'all asked. What we're going to be talking about today is generic versus brand name medications. This is a question I get asked a lot, and I wanted to have y'all have a better feel for that. So, the first thing to talk about is, are they the same? The answer is yes and no. The active ingredient in the brand name, the active ingredient in the generic is the same. What makes them different are that the fillers are different, and the fillers can affect the absorption and thus the efficacy of the drug. Now, theoretically, drugs, in order to be classified as generics and to be allowed to be dispensed, have to show bioequivalency. That means that they actually have to show that they are absorbed by the body to the same magnitude or degree as the brand names. Now, there is a little bit of a window. The window can be 80 to 125, meaning that that the generic companies are allowed to theoretically have 80 to 90% of the efficacy, not efficacy, absorption, 80 to 90% of the absorption, and theoretically could have more than the absorption versus the brand name. In other words, up to 125. So 80 or 90 to 125 is the realm. Most of us really feel that generic drugs don't provide more absorption. Most of us in practice feel they may provide a little bit less. Now, the advantages let's talk about advantages and disadvantages. Advantages of generics are cost-wise significantly less expensive. So certainly, if people are on multiple medicines, there may be some medicines that they have to get generic because the cost of the brand name, if the insurance won't pay for it, which often they won't, is not doable. However, even though theoretically, and there's been lots of studies looking at brand name versus generic and stating that the drugs are the same, that the efficacy is the same, those of us in clinical practice have definitely seen people where they've done really well on the brand name and they switch to the generic and the efficacy is no longer there, or the tolerability is no longer there. So here's where I go. If indeed a generic is well effective and tolerable, i.e. the patient switches from the brand name to the generic and they're able to do well or adequately well, then the cost difference is hard to argue. But there are a group of people that the difference, whether it's the fillers or some other byproduct where patients will clearly tell you, I am not feeling the way I was on the generic versus the brand name, and those are the cases where I try to get the brand name for the drug, meaning sending in a prior authorization to the insurance company, or if it's a drug where the insurance company refuses to give that to them, having them look at samples. Some patients even go to Canadian pharmacies where you can frequently get a brand name drug at a third to a fourth of the price of the American price to get it via a Canadian brand pharmacy, i.e. in other words, you're getting the brand name drug at a third to a quarter of the cost of what it would cost in America. So these are all options. So what I'm saying here, the take-home message is, generic, when the pharmacists tell you that the product's the same, they are telling you the truth in that the active ingredient is the same, but the fillers are different. For the majority of people and the majority of drugs, the generic drug can provide an adequate drug. But there are definitely people, I see it every day in my practice, where they were doing great on the brand name and they are no longer doing great clinically on generic. In other words, recurrence of symptoms, or I have patients who they do fine on one generic drug, but not another. Even amongst the generics, there can be individual differences. So we can see that too. So what I want to do is I want to give you all that knowledge, talk with y'all's clinician about it, and be more informed about that. Generally, they are effective, but there might be cases where it's not. And sometimes you as the patient actually have to be actively involved in getting what you need to help keep your health status. In my case, for psychiatry, but it could be general medicine, cardiovascular, etc. With that in mind, I hope you all have a great day. This is Dr. Barry Gritz, Houston's dancing psychiatrist. Hoping you all have a great day. Reminding you all that tomorrow at 7 p.m. we dance at 19550 Restaurant Row in Katy. So hope you all can join me 7 p.m. Dancing psychiatrist Dr. Barry Gritz, wishing you all a great night.